Hi, my name's Charlotte and I'm the founder of UKCV Family.
I'm Caroline and I'm the author of the COVID Vaccine Adverse Reaction Survival Guide.
And I'm Harriet. I'm a SARS CoV2 researcher in the NHS, but I'm here as a patient with a vaccine injury.
And you're a member of UKCV Family as well, aren't you? That's where we met you, I think.
Yes, I'm a very happy member.
As happy as we can be, anyway.
I'm happy I found a group.
I think the thing that makes me smile the most generally are conversations with people on the group at the moment.
Yeah. It's a group who understand everything, like not just the living with it, but all the shit that we get from everyone about it, like from the scientists who call us anti-vax misinformation spreaders to the anti-vax people, if we want to call them that, who call us sheep and idiots for ever getting the vaccine, and everything in between. Our group understands that like no one else does, so I think it's nice to connect with each other.
And but we make each other smile. Like one of my highlights of each day really are my little chats with Charlotte. Whenever we have a chat. No, it's true, because there's an awful lot of tears, I think, in this situation. And if we're feeling worse physically, it doesn't help us emotionally either. And I know I've cried so many tears in the last 16 months, but I'm getting to the point now where I'm actually laughing quite a bit as well. And the balance, there's tears of laughter and the tears of sadness, they're still there, they haven't gone away, but you guys make me laugh a bit. Are you very full of laughter today, Charlotte? How are you?
Yeah, I was just going to say that I think for me the worst bit is that when I have like a relapse of symptoms, that's when I tend to go downhill emotionally as well. So it's kind of like you have a little run of good days and then suddenly, bam, you're back to what it feels like square one, and you're back in bed and you're back to having, medication and all this other stuff. And it's just like, oh no, this is my life. And then you have to come to terms with it all over again. Whereas when you are having like a run of good days, you feel like you're getting better. There's clear kind of progression on, you can see that you're feeling better and better. And then it's like, bam, back to the beginning again. So that's when I get personally a bit emotional, because I'm like, oh no. And it, I might only be like that for 1 or 2 days, but it happens every time.
I feel a bit like when things are feeling like, oh, I'm okay, and it can be just like a few hours of feeling okay, a bit of me thinks, oh, is it really that bad? And a bit of me thinks, am I imagining it? Do you get that as well? Sometimes you literally feel like, is that real? Is it real? When I'm feeling absolutely awful, did that really happen? Do you get that too?
Definitely. I mean, like, I feel like I've been drunk for the last however many months, and whenever I'm relapsing, I'm like, I am never drinking again. So I've not had a drink since I had the vaccine. And yeah, every time I relapse, I'm like, I am never drinking again. And then when I start to feel better and come out of it, I'm like, I really wouldn't mind just sitting in the park with some friends, getting a bit drunk. And then I relapse. I'm like, no, being drunk is awful. Don't do it.
I got drunk on an apple. I did. And actually, this is a little bit of progress this week. So I had an apple this week, and it's the first time in almost a year that I've had an apple, because about a year ago, I had an apple and I felt drunk, and it was like I'd been drinking wine, and it felt so strange and it freaked me out a little bit. And this is part of all these weird food reactions. So that was one of them that I have found, again, found a way to laugh about it. But I had an apple this week and it didn't make me drunk. So that's my progress. Charlotte, you've been drinking though, haven't you, throughout it all?
Make me sound like a real lush.
No, not like that.
I've still been having 1 or 2 glasses of wine. So yeah, I limit myself, but I do still have 1 or 2 glasses, and I actually find it makes me feel better as long as I stick to 1 or 2. And I don't know, it actually makes me feel better for a good chunk of time. So I don't know whether it's the blood thinning properties or something else going on, but it's weird. Obviously, if I go over 1 or 2 glasses, then it's bloody awful, because you get I did it at Christmas. I get a flare, massive flare up of symptoms plus the hangover. So it's like the worst hangover in the world. And, folks, don't try this at home. I probably wouldn't recommend it when you're going through a vaccine injury. It's not something that you should be doing at all. However, going back to that, you've been very rigid in what you do and don't do, haven't you, Caroline? Your diet, everything. Whereas I have been this kind of person all my life, and I kind of look at it as, if 1 or 2 glasses of wine is my moment in the week that I enjoy, because a lot of things have been taken away from me. So if my 1 or 2 glasses of wine on a Friday evening is something that I really look forward to and I enjoy, I'm going to keep those 1 or 2 glasses until a doctor tells me don't have it. I'm not going to stop.
How big are these glasses?
Quite big. Yeah, they're quite big.
I was really interested to have you on the chat, actually, Harriet, because one of the things that, and this might be related to when we feel really down. I don't know about you guys, but when I feel really down, one of the things that are bothering me, it's to do with it's more kind of existential. It's more like what's happening in the world and what's happening to people who are vaccine injured and what's happening to anybody in pain, and how are we greeting all of these challenges with compassion. That's been my one thing, I think, throughout all of it that I found quite difficult to cope with, is seeing how unkind people have been, not just to vaccine injured, but just to each other in general. I think people have been quite unpleasant over the last year and longer. And adjusting my way of looking at the world, knowing that people are that unpleasant, has been quite a shocking thing. So there's that element of it. And then there's everything that I've kind of fundamentally believed, I suppose, to do with perhaps healthcare, what doctors really think they're there for, about government, about all sorts of different things, all much bigger questions. Those kinds of things I found quite difficult to deal with. I'm adjusting my entire worldview, and that, I might not be explaining this well. I'm trying to. See, I'm still adjusting to it. I can't even explain it very well, but I'm basically adjusting my worldview, and that whole process, I have found it to be quite challenging. I'm much more comfortable with it now, but I found it quite challenging at the beginning. And your job, Harriet, working in the NHS and working within COVID research and being a vaccine injured person, I find that fascinating, because there's so many things that you must have learned, both professionally and personally, that would throw your worldview completely off. So I'm interested in how people cope with that. How do we cope with anything? Because there are other things that happen in life that throw our worldview. Abusive relationships have a habit of throwing people's worldviews. Bereavement, which, Charlotte, you have that experience. Those kinds of things all affect our worldview. So how do we adjust to that?
Wow. I don't have answers. I mean, I can talk a bit about my experience, because, like you say, this has been a big learning experience for me personally and scientifically. On the personal level, looking back, sad to say, I probably did contribute to quite black and white thinking about vaccines. And there's almost, I feel like there's almost a narrative within science that tells you that vaccines are incredibly safe, other than this very small select group of people who get already known about conditions like Guillain-Barré syndrome, and even those aren't really talked about. And you know, when one of my neurologists said very like casually, "Oh, you've got post-vaccine syndrome," I was like, "This is a thing? Like, if this is a thing, why have I never heard of it? Why has basically no one ever heard of it, other than a few seeming doctors who might be open-minded enough to diagnose this? And why don't we say on the package inserts, like, we know with other vaccines, some patients get a post-vaccine syndrome and we don't know much about it. And although we didn't see this in the trials, there may well be a risk of this. Like, I don't know why we don't just have that precautionary measure. But on a personal level, you know, I've definitely contributed to some black and white thinking regarding vaccines. And, you know, if I hope I've never like upset anyone, but if I have, I would love to have a chat and clear the air, because yeah, this has been a really big learning experience for me to be much more open-minded to what in my world is classed as anti-vax. You can't talk about that because that's just nonsense, when clearly it isn't. So personally, it's been a big growing experience. And then scientifically, oh, you know, it's a minefield, because all your training in understanding causality and, you know, what's in an anecdote, and when does an anecdote become something that you should really pay attention to? When is it a coincidence? I mean, it just breaks through so many scientific barriers that I had in my head that I mean, I'm known in my field for being quite wacky. I've written a couple of papers that have said I think our consensus in my expertise is wrong, and I deal with that. So, you know, my whole PhD was premised on some ideas that I'd had and researched and looked into, and my PhD said, actually, I think that's wrong. So I'm quite used to being wrong scientifically, and I'm quite like an open-minded scientist. And I realized I had actually quite a lot of barriers in the way, and it's a mind fuck, to be honest, because living through a vaccine injury, there is no doubt in my mind that I'm vaccine injured, and people will throw at you, did you have COVID? Is it a coincidence? Blah, blah, blah. But in the least scientific explanation possible, I think the vaccine injured just know within us, like, things haven't been right since the vaccine. Like, this was the vaccine. And, you know, my personal experience of like taking antihistamines, like they've sent me from being pretty much bedbound to being functional. Now, reverse that to like a couple of years ago before I was vaccine injured, and if someone told me that, I would have a list of reasons as to why that's not causal, and I would be able to science my way out of that and be like, yeah, look, you can't really make any inferences based on that. And now I'm like, you bloody well can make some inferences based on that. So yeah, it's been a really, I hope I'm a better person for it, and I hope I'm a better scientist for it. And I hope that my kind of credibility as a scientist will help in some way the community get some scientific recognition. So I just kind of want to do any bad that I've done in the past and try and make up for it now, and let's get this recognized, not just for vaccine and not just for COVID vaccines, but lots of every vaccine. You know, there's a whole world that in my head has just been anti-vax nonsense, and you know, even that term is very divisive, and you know, we should use that in a very specific manner, not just to say anyone who talks about vaccine injuries is anti-vax. You know, it's ridiculous. So yeah, learning all round, but I don't have an answer to your question, unfortunately.
I think it's interesting that, you know, because obviously I love science, but I'm not a scientist, obviously. And yeah, all those things that you talked about, you know, people say, you know, I want to see your medical records. I want you to prove it to me. I want to see how many tests you had to see if you had COVID before, during and after your reaction. And, you know, I've got that stuff. But to all those people that ask me for it, I say to them, well, let me see your private medical records and put those online for me to view. How do you feel about doing that? You know, your private medical information, you know. And it's, I think a lot of people just have to, especially doctors, have to listen to their patients more. You know, when their patients are saying to them, I'm not well, you know, something is very wrong with my body. Yes, of course, you know, there's a mental component to illness. So, yeah, you know, provide mental health support, but don't disregard all the physical symptoms as mental health problems. And I think that's where this is where, you know, kind of not challenging that narrative is detrimental to the patient, because if it's not widely known that you can have these reactions, you know, and it's not known by doctors and it's not taught to them, and there's no protocol to follow for them or no unit to refer them to in the country, when we turn up in a doctor's room and we say, you know, I've had this reaction from my vaccine, we're just met with, really, you know, it can't be, you know, and a blank look most of the time.
Yeah, it does baffle me, and I get it, like, you won't necessarily understand the ins and outs of this particular vaccine injury, but I don't feel like we should be turning up to doctors and then being like, nah, can't be vaccine. Like, surely, like, why isn't it better known that we can get post-vaccine syndromes? It's actually absurd, and I just don't think that it would make that much of a difference. And like, you know, when the VITT risk came out, so I was AstraZeneca injured. I had it just as the VITT risk was coming up. And I think about 2 weeks after I got vaccinated, it was banned for people my age. So I knew about that risk, and I was like, well, I don't want COVID, so it actually makes sense to still get vaccinated. It didn't seem to stop people getting AstraZeneca, and it was all over the media. So I think people are better than we give them credit for to understand these risks. But what absolutely isn't acceptable is that we go to the doctors and they just shrug. Like,
my GP, she's good. She'll say, I don't know, with things. And I have more respect for any doctor that will just come out and say, actually, I don't know. And I think maybe we live in a society where we expect the doctors to have all the answers. We expect pharmaceutical oriented medicine to have, we expect the people who work in that industry to have all the answers. And I don't think we should be even going to doctors and expecting them to have answers. I've said for years now, I go to a doctor because they studied something different at university than I did. So they have some expert knowledge in a specific field. I'm going to consult with them. I'm just going to get their advice. They're not going to make decisions for me. I'm not going to expect them to have all of the answers. And I really don't mind if they say, I don't know. I think that might have been one of the first detailed conversations I had with my GP, was I just said to her, I don't expect you to have all the answers. But why do they have problems saying that? Why can't they just say, I don't know? Why do we expect them to have all the answers? And why do they act like they have all the answers?
Yeah, I mean, it's a great question. I mean, I've had very mixed experiences. I've had, like, when I first called 111 when I was bedbound, the first doctor I spoke to asked what my job was, and I told him, and he said, oh, well, you probably know more about this than I do. Just get a COVID test and see how you are. And I was like, well, I guess that's honest. I don't have COVID, I know that, I did a test. But yeah, I don't know what this is within medicine, that there's almost like we have to know the answer, and if we don't, we'll make it up, or we'll call it psychological. And I mean, I've had it even before COVID, like, so so I've done a bit of work in gut bacteria, and I've had doctors. Oh, my second postdoc was in microbiome, and I've had doctors tell me with all the confidence of a white man everything about microbiome and how I need to do X, Y, and Z to change mine. And I've sat there and I'm like, this is literally my job, and that's not correct. And they're like, no, it is. And I've had doctors tell me all about how carbohydrates in my diet, and I'm like, my PhD was focused on glucose metabolism. I think I know a little bit about this. And they're like, no. And there just seems to be like an arrogance in, and to be honest, there's an arrogance in science that needs to be demolished too. But you get this status in society, and I guess you just have to play up to that. And to be fair, everyone I've spoken to scientifically and medically who have had initially some reservations about these vaccine injuries, after I've spoken to them, no one has gone, no, you've completely missed the point. This is a much better explanation. They've either been a bit like skeptical, but not been able to critique any of the science, or they've gone, actually, you might be onto something here. So actually, when I sit down and explain it, no one's really denying it. And some of them have called us quite nasty names, and yet when I've explained it, they've gone, I haven't got any scientific critique to that. So yeah, I don't know, it's baffling. I mean, then in science in particular, because the whole premise of science is that you need to be open-minded to your ideas being wrong. And our ideas, our scientific narrative ideas about vaccines is wrong.
Yeah, I think you did a really good blog post actually about FND, didn't you? Because that is one case where people, and I don't want to offend anyone that is genuinely diagnosed with FND, it's a very serious illness, but it's one of those diagnoses that if you get it, you then aren't followed up on any other pathophysiological changes. So once you have that diagnosis, the treatment is psychological therapy, isn't it?
Can you explain what FND is?
It's functional neurological disorder.
So what does that mean?
Harriet?
So the way that the way it's most commonly explained is it's software problems. So there's no hardware problems. So you might not necessarily see structural changes in sort of brain scans, but the way the software works leads to kind of things going wrong. Now, even if we accept this, which personally I don't, I do, I accept that there are times when the nerves don't work as we should, but we don't seem to call those conditions FND. We give them a name. But even if we accept FND and we say, yes, this is definitely legitimate, the issue I really have with it is that the proponents of it say it should be a positive diagnosis. So if you have the symptoms of it, then you're kind of, that's it, you have FND. And they've got a couple of markers of FND, like the Hoover's test. And if that comes back as positive and you've got the signs of FND, then you have FND, and that's that. And it's dangerous on so many levels, because I know people who have had a severe B12 deficiency. There's cases in the literature of MS patients. I know a patient with Parkinson's. They all got FND'd, and now vaccine injuries, long COVID, ME have got a horrific history of being FND'd, and we're all just getting it. And then what does that do? Well, it means that we're not getting tested properly, but we're also stopping scientific progress, because if we're not testing patients, then we can't be aware of their pathophysiology, and those case studies in the literature can help drive hypotheses so we can actually test these things. So it blocks not just the patient well-being, it blocks scientific progress into understanding, you know, where's the curiosity there? Like, you see a patient have a seizure, or they've got a tremor, and you can't explain that by any of the very kind of basic tests you might do, and you just go, oh, it's functional. Why aren't you like, why is this person tremoring? Like, that's fascinating. Like, what can we learn about this? Like, but there's none of that. It just seems to be FND. It's so bad for patients, and the patients are suffering. I think they're all suffering, and I worry so much that people with FND have got some serious pathophysiological problems that are going unchecked. And, you know, in my case, they would have preferred to send me to cognitive behavioural therapy, and that means I would have never got the pulmonary emboli in my lungs found. So I would have eventually got a stroke, and I would have had to go back to neurology to deal with the stroke side effects. So, you know, it's not benign, it's really quite serious, this, you know, positive diagnosis attitude that they've got. I feel like it should be a diagnosis of exclusion if we're going to use it. And there is a few of us who are doing some work on FND at the moment to try and raise some academic awareness about this.
If people want to read your blog, Harriet, what's your website address? What's your blog address?
It's don'tbelievehype.co.uk.
Excellent.
We've come, this time goes so quickly, half an hour is not enough, but I feel like it's enough for people to listen to. It's not enough for us to talk. I know we can keep talking for ages, but
we can chat for hours.
We can. What I love hearing from you, Harriet, is I think it's quite brave to admit that the way that we might have looked at something in the past is actually, you know, it has been fundamentally changed, and perhaps we were wrong. And I think there's not enough of that in the world in general, actually. And I know that I've used, particularly use of the word anti-vaxxer, actually, that was something that I have learnt a lot about over the last 16 months, and that would be a whole other topic. I find that quite interesting, that word and the way that people use it, so that could be another topic of conversation. But as we finish off this one, I want to say just thank you, Harriet, for coming and joining us and telling us a bit more about your experience. I hope that you'll come and chat to us again, and thank you for being one of those scientists that says, you know what, I was wrong about this, I don't know everything, I'm really open-minded, and we need more people like you.
Oh, thank you for having me on, and just thank you massively to all the work you guys have done for UKCV. It's just a fantastic group in terms of the support that we all give each other. It's invaluable. So anyone with a UK vaccine injury, I would recommend joining our group.